Hi everyone, my name is Sarah Bowles, and this video will cover infections of the urinary system such as cystitis, pyelonephritis, and urinary tract infections, or UTIs. I chose these topics because of how frequent they can occur in various individuals of different ages, different sexes, different pre-existing medical conditions, and how they can greatly affect your everyday life. Hope you enjoy. To start, the urinary system, also called the renal system, is composed of the kidneys, bladder, ureters, and urethra. Its purpose is to remove waste from the body, regulate blood volume, and regulate blood pressure. Simply, it's the body's own drainage system that filters blood and excretes urine. The main job of the urinary tract itself is to rid the body of metabolic waste products. Infections of the urinary tract undermine vital functions of the system. A urinary tract infection is an infection anywhere from the kidneys to the bladder. They are the second most common bacterial infection in people when pathogenic microorganisms from outside the urinary system find their way into the tract. They have a large economic impact, nearing $1.6 billion in medical expenses each year, and they are one of the most common hospital-acquired infections in the United States. Women get more urinary tract infections than men for various reasons. The anatomy of the urinary system in women is different in the length of the urethra as well as the location of it. Nearly 1 in 3 women will have had at least one episode of a UTI requiring antimicrobial therapy by the age of 24. Almost half of all women will experience one UTI during their lifetime. Urinary tract infections are caused by pathogenic microorganisms in the urinary tract. The normal urinary tract is sterile above the urethra, and UTIs are caused by both gram-negative and gram-positive bacteria as well as by certain fungi. Diagnosis of a UTI means to find a significant number of bacteria in the urine. Most common causes are uropathogenic E. coli or Staphylococcus aureus. Another potential cause of a UTI is the inability or failure to empty the bladder completely. Stasis of urine inside the urinary bladder attracts bacteria into entering the tract. For infection to occur, bacteria must first gain access inside the urinary tract. The bacteria then attach to the epithelium of the tract and colonize it to avoid being washed out. The defense mechanisms are then evaded by the host, and as the defense mechanisms react to the bacteria, inflammation starts to set in as well as other signs of infection. In most cases, the bacteria comes from the digestive system as it expels its wastes through the rectum. Due to the close proximity of the rectum to the urethra, improper sanitary methods allow for bacteria to be transmitted to the urinary system. UTIs don't always present signs and symptoms, but when they do, they can include strong and frequent urge to urinate, cloudy, bloody, or strong-smelling urine, pain or burning during urination, nausea or vomiting, and abdominal pain. Tests and procedures used to diagnose urinary tract infections include analyzing a urine sample, growing urinary tract bacteria in a lab, creating images of the tract, or using a scope to see inside your bladder. Your doctor may ask for a urine sample for lab analysis to look for white blood cells, red blood cells, or bacteria. To avoid potential contamination of the sample, you may be instructed to first wipe your genital area with an antiseptic pad and to collect the urine midstream. Lab analysis of the urine is sometimes followed by a urine culture. This test tells your doctor what bacteria are causing your infection and which medications will be most effective. If someone is having frequent infections that your doctor thinks may be caused by an abnormality in your urinary tract, you may have an ultrasound, a CT scan, or an MRI. Your doctor may also use a contrast dye to highlight structures in your urinary tract. Anyone is at risk for a bacterial infection causing a UTI, but specific subpopulations at an increased risk include infants, pregnant women, elderly, patients with spinal cord injuries or catheters, patients with diabetes, or patients with underlying urologic abnormalities. Treatment of UTIs depends on the cause. Your doctor will be able to determine which organism is causing the infection from the test results used to confirm the diagnosis. In most cases, the cause is bacteria. UTIs caused by bacteria are treated with antibiotics. In some cases, viruses or fungi are the causes. Viral UTIs are treated with medications called antivirals, and fungal UTIs are treated with antifungals. Not everyone is doomed to get a bacterial infection resulting in a UTI. There are some general tips that men and women can follow in order to reduce their risk. One of them is clean your genitals before and after sexual intercourse, urinate immediately after sex, wash your rectum daily, drink lots of water, and don't hold your urine. In women specifically, women should avoid douching, choose showers over baths, avoid harsh or scented soaps, wipe from back to front, use condoms, and wear breathable cotton underwear. Urinary tract infections are also very common in children. However, many of these infections can be avoided by teaching children about hygiene and other healthy habits. Some quick tips for kids would be to never hold it. Kids should go every 2 or 3 hours when they're awake, and if they don't, they may only serve to force the bacteria deeper into the urinary tract and cause infection. They should practice good toileting habits. This includes teaching kids to take their time when they go to the bathroom and completely empty their bladders. Change undergarments and wear clean underwear every single day, as well as keep very well hydrated. Kids ages 5 to 8 should drink 5 glasses of water per day. Studies show that drinking a glass of cranberry juice each day may help prevent recurring urinary tract infections. New research also suggests a similar effect from other cranberry products, including dried cranberries and dietary supplements. Cranberries contain compounds that may stop certain bacteria from attaching to the urinary tract wall. For those with diabetes or at risk for diabetes, low sugar or sugar-free options are available. Even though they are common, urinary tract infections, if left untreated, are no laughing matter. If the infection spreads beyond the bladder, it can reach the higher parts of the urinary system, such as the kidneys and the ureters. When the infection reaches these areas, urosepsis is one possible complication. In addition to UTI symptoms, people with urosepsis may also display more serious symptoms common to other forms of sepsis. Anyone experiencing these symptoms should seek immediate medical care. In some serious cases, urosepsis may progress to severe sepsis, septic shock, or multi-organ failure. People with severe sepsis produce little to no urine. They may have difficulty breathing, and their heart may have difficulty functioning. One of the 2 types of UTIs is called cystitis, also called lower urinary tract infection. Cystitis is the inflammation of the bladder. In most cases, the cause of cystitis is a urinary tract infection, but it doesn't always have to come from an infection. For example, certain medicines and hygiene products can also cause inflammation of the bladder. Most cases of cystitis are acute or occur suddenly. Interstitial cystitis cases are chronic or long-term. Less commonly, cystitis may occur as a reaction to certain drugs, radiation therapy, or potential irritants, such as feminine hygiene spray, spermicidal jellies, or long-term use of a catheter. For infection to occur, bacteria must gain access to the bladder. Bacteria must then attach to and colonize the epithelium of the tract to avoid being washed out. Bacteria must evade host defense mechanisms, and then once the bacteria has evaded the defense mechanism of the body, inflammation now starts to set in of the bladder. And this is just a brief image to show the potential track of how bacteria can find its way to the bladder. Symptoms of cystitis include dysuria, or painful or difficulty urinating, increased frequency of urination, burning pain while urinating, pelvic discomfort, a low-grade fever, or feeling of pressure in the lower abdomen. Different diagnostic tests to detect cystitis include microscopic urinalysis in order to show red blood cells and white blood cells, urine culture, cellular studies, leukocyte esterase test, or even a CT scan. Most cases of cystitis occur in women, and it is nearly 10 times more common for women than men. It affects 10 to 20% of all women at least once, and a lower urinary tract infection is a prevalent bacterial disease even in children as well. Treatment for cystitis includes appropriate oral antibiotics according to the particular bacteria, a single dose of antibiotics for 3 to 5 days, and a urine culture taken 1 to 2 weeks later after the infection has cleared to determine it has been completely eradicated. Cystitis can have a great impact on people's everyday lives. Here is just a small tidbit of a personal account from a woman who is living with chronic interstitial cystitis. She was going to the bathroom constantly throughout the day, around 60 to 70 times, and also getting up 6 to 8 times or even more at night. This caused her to be extremely sleep deprived and also suffering from chronic pelvic pain, burning on urination, urethra, and vulvar and vaginal pain. She has found 2 treatments that are helpful but have not been significant enough for complete relief. She wanted to continue to work but is now on disability due to the severe nature of her condition. Pyelonephritis is a type of upper urinary tract infection that is defined as a kidney infection. It begins in the urethra or your bladder and travels to one or both of the kidneys. Pyelonephritis is caused by bacteria that enters the urinary tract through the urethra and can multiply and travel to the kidneys. This is the most common cause of kidney infections, but bacteria from an infection elsewhere in the body can also spread through the bloodstream to the kidneys. Symptoms of this type of urinary tract infection include painful or burning urination, a fever higher than 102 degrees, cloudy urine, pain in the abdomen, back, side, or groin, bloody or foul-smelling urine, and nausea. Similar to other urinary tract infections, different ways to diagnose pyelonephritis include a urine sample to determine if white or red blood cells are present, culture the urine, or even intravenous pyelogram or a CT scan to determine if the kidneys are enlarged. Anyone is at risk for a kidney infection even though they are quite rare, but people with an increased risk include women, older adults, people with chronic kidney stones, people with extensive catheter usage, people on certain medications, or patients with nerve or spinal cord damage. Antibiotics are the first line of treatment for kidney infections. Which drugs you use and for how long depend on your health and the bacteria found specifically in your urine tests. Usually the signs and symptoms of a kidney infection will begin to clear up within a few days. A doctor might even recommend a repeat urine culture to ensure the infection has cleared completely. Acute pyelonephritis is a potentially organ and life-threatening infection that often leads to renal scarring. It results from a bacterial infection initiating from a urinary tract infection. Timely diagnosis and management of acute pyelonephritis has significant impact on patient outcomes. Thank you for tuning in to this presentation. I enjoyed researching and learning more about these topics. Thanks.